It's important to know that PTSD is a treatable condition. It is not a life sentence. However, PTSD does not tend to go away on its own and often requires some assistance from a mental health professional to overcome symptoms. There are two important first steps to getting help. The first is admitting that there is a problem and knowing that to get better, you may need to get help. The second step is to get a diagnosis from a clinical psychologist or psychiatrist. That person should do a thorough diagnostic interview to ensure that a diagnosis is appropriate as opposed to other conditions. This is really essential in identifying the correct treatment approach, and PTSD is often misdiagnosed as ADHD, bipolar, depression, or other anxiety conditions. If you are seeking treatment for PTSD, try to find a provider in your community that offers one of the following approaches: cognitive processing therapy, or CPT, or prolonged exposure, PE. These approaches have a significant amount of empirical support behind them and can be researched at www.ptsd.va.gov. Another approach, eye movement desensitization and reprocessing, or EMDR therapy, has also received support. One of the fundamental reasons that individuals get better with any of these treatments is because each requires a person to confront their experiences and stop avoiding. Unfortunately, this can be a very scary proposition for someone suffering from PTSD and may be a barrier to seeking and staying in treatment. However, they have been shown to be effective for those who engage in them. In addition to my role as Associate Professor of Clinical Psychology at Northern Illinois University, I'm a licensed clinical psychologist in the state of Illinois. In spring of 2018, I reached a point that I could no longer tolerate getting emails from telecommunicators asking for help to identify a confidential provider in their local community. Folks were reporting to me that they were having a particularly difficult time finding a provider who offers the treatment approaches that I just mentioned. As a clinician trained in these approaches, and who now trains doctoral students to provide evidence-based PTSD treatments, I decided to start 911 Recovers. 911 Recovers is a telebehavioral health organization that provides evidence-based treatment for telecommunicators and other first responders. That is, I work with individuals suffering from PTSD and other conditions, such as depression or anxiety, using secure video conferencing software. Telebehavioral health has become very popular and has even been adopted by the Veterans Administration. I have a website that provides information about services and my research at www.911recovers.com. Unfortunately, I can only treat individuals residing in the state of Illinois at the present time. However, the landscape of telebehavioral health is rapidly changing and interjurisdictional practice is on the horizon for the year 2020. I keep my website updated with information on this issue. Prevention and early intervention are key, not just for PTSD, but for other conditions and for stress more broadly. Recognizing when you might need help is an extremely important first step. With Dr. Hendrika Mishka and her team at University of Washington, we developed an online mindfulness-based intervention that was shown to reduce stress in telecommunicators who engaged with it. It's free and available at www.nwcphp.org under Training and Opportunities.
Well, you kind of always try to leave it here, which I feel like if you are meant for this profession, it's hard to do anyways because you care.
My faith life is very important to me, and that helps me a lot through bad calls, especially if I'm on the phone with somebody, and once I hang up with them, I'm praying for them.
Developing rituals to keep work at work may also help to prevent the stressors of 911 work from leaking into one's personal life. Many agencies have started to introduce formalized peer support training into their agencies. It helps to normalize the experience of talking about upsetting duty-related events and includes following up with peers who may be struggling. Call centers need a coordinated, proactive approach to promoting wellness among their employees that focuses on enhancing physical and mental health and optimizing employee relations and communication. This is essential as the industry transitions to NG 911. Unfortunately, stressful work environments, particularly those challenged for resources, can become toxic work environments marked by relational aggression, microaggressions, bullying, social loafing, that is doing as little as you can on the job, or problematic leadership.
Honestly, one of my biggest stress reliefs that I've always done is working out. Whenever I get done here, I go into our gym, spend an hour in there, and it just kind of gives me an hour to myself. My music, don't have to talk to anyone, and I kind of focus on that.
Telecommunicators working in such agencies are at very high risk for attrition and poor health. In these cases, it is imperative that call centers get the help they need to improve employee relations. This includes identifying and hiring the right employees through thoughtful screening and hiring procedures. If a call center has become a toxic work environment, they will likely need outside assistance and training to help change the trajectory of their agency, as trying to heal and make change from the inside is often difficult or impossible. Again, with NG 911 on the horizon, detoxifying and bolstering our agencies is more important than ever. Yet the returns on clients' investment in therapy is diminished when they continue to work in environments in which wellness is not promoted or the culture is toxic. I've started Lilly Consulting to help agencies develop wellness promotion programs and to help intervene in centers marked by relational aggression and poor communication. If you want to learn more, my website is www.lilly-consulting.com. 911 Recovers focuses on the needs of individuals, while Lilly Consulting is focused on the needs of the agencies in which they work.